I'm joined now by Congresswoman Terri Sewell, representative for Alabama's 7th Congressional District and a member of the House Ways and Means Committee. And I'm so grateful the Congresswoman is joining us today. She is one of our 2020 Medicare Advantage Breakthrough Champions, and we're so pleased to have you join us today. Welcome.
Well, thank you so much, Mary Beth. The Alliance is so important to me, and having the opportunity to be a part of the summit is a real joy. So thank you for the invite.
Oh, well, thank you. I'm going to just go ahead and get started with some questions to kick off our discussion. Thank you. And really where I want to get started is really leading off with your district and the MA presence that you have there. Over 52% of Medicare eligible individuals are in your district and choose Medicare Advantage. And that really compares to the overall Medicare Advantage enrollment rate of 42%. And I'm just curious, I know you've been a champion of Medicare Advantage, and why do you think Medicare Advantage is so resonant in your community among seniors?
Well, I'm happy to be ahead of the curve, my district being ahead of the curve with 52% choosing Medicare Advantage or Part C. I think the Medicare Advantage offers coverage for things that original Medicare doesn't cover, like fitness programs or some vision or hearing and dental. And for me, my district, which includes the historic cities of Birmingham, Montgomery, my hometown of Selma, Alabama, it is a civil rights district, but it also is a district that has lots of needs. The median income for a family of four in my district is $34,000, and that's in 2021 terms. And so when people are talking about healthcare and health equity and healthcare generally, it's about access, and the social determinants of health are really in full force and effect in my district. Transportation, poverty. So access issues are really important. And so I think that Medicare Advantage plans, can cover more. They can cover things like transportation to doctor's offices or over-the-counter drugs and wellness benefits. And so I think that it's a flexibility that the Medicaid Advantage plans offer, as well as the ability to customize to treat specific conditions, And this year of 2020, the COVID pandemic has really laid bare systemic disinvestments that have happened especially in communities of color and rural communities across this nation. And so, I think that the Medicare Advantage plans tend to be more customized and more specific, and do offer more flexibility and benefits.
Thank you. Thank you. Another area that we wanted to focus on with you is health disparities. You have been a real leader in that space, given the community you represent, and you have really shown your leadership in serving on the Ways and Means Health Subcommittee, being a co-chair of the New Democrats Coalition Healthcare Task Force. And, health equities has been a real priority of the Better Medicare Alliance, and Medicare Advantage has served minority communities. And just as we prioritize that area and that issue and the service that we need to provide to that communities, how do you think Medicare Advantage can really do more in combating health disparities and achieving health equity? And are there particular efforts, on the part of Medicare Advantage in that space that stand out to you?
Well, when I think about my district, and when I think about my position on Ways and Means, I very cognizant of the fact that these social determinants of health really do affect health outcomes. And the greater the health equity, the better the health outcomes are. And so I think that to the extent that Medicaid Advantage plans offer more and better options to our seniors that address these social determinants of health, the better off we can close that health disparity gap. Now, it's abundantly clear to me that both policymakers, along with CMS and HHS and our states, must take responsibility for fixing these deficiencies so that our health system is better equipped right now and into the future. I'm painfully aware of the pervasive and systemic institutional influences that have really affected the disparities that exist in my district and across America. And I think that what we see is lots of seniors, when polled, talk about combating these health disparities by providing, the seniors with more plan options that are tailored to their medical needs. And so, to the extent that Medicare Advantage offers that customization, that's appealing. To the extent that Medicare Advantage is also provided. Many of the plans can provide transportation opportunities as well as supplemental benefits for COVID-19, and that's been appealing to a lot of the seniors. I just think that to close that health disparity gap, we really have to address some of those social determinants of health. And I think that being able to provide better access through better transportation, I'm excited about the prospects of this bipartisan infrastructure bill that will bring more fiber optics and broadband to underserved communities and rural communities that I represent. I think that we have seen through this pandemic an exacerbation of existing health disparities. And so what we have to do is put the investment on the front end to try to close the gap in the health disparities. And I think that Medicare Advantage plans can go a long way to the extent that they are offering lower premiums and lower copays and better flexibility. And so, I am a real champion for any and all things that will help decrease that gap in social determinants of health. I'm a proud product of my district. I often say that what we lack in economic prosperity, we more than make up for in heart and spirit and fight. My district was a district that brought us the Civil Rights Act of 1964, and my hometown of Selma, Alabama is where John Lewis and others crossed that bridge and got us the Voting Rights Act. And so, look, I come from great stock. What we need, though, are better resources and more opportunities. And to the extent that Medicare Advantage plans can align with the needs of the community and offer some of the lower cost plans and be able to address some of the issues like transportation and access.
Well, and thank you so much for talking about social determinants of health, because that is an area that we're spending a lot of time talking about with our allies at this summit. So I really appreciate you talking about the importance of social determinants of health and the benefits that the Medicare Advantage provides.
Absolutely. On Ways and Means, Chairman Neal put together a racial equity initiative, and he had me as co-chair along with Representative Gomez and Representative Horsford. And so in looking at the budget reconciliation bill and the things that are coming out of our committee, to really look through it through an equity lens. And I think that a lot of that has to do with dealing with just the systemic disinvestment that has occurred in certain communities, and being able to have intentional and targeted efforts to close those gaps will be critically important.
Yes. One area I did want to ask you about, Congresswoman, we had your Republican colleague, Brett Guthrie, as part of the summit speaking, and we asked him what he thought about what was happening with the reconciliation bill. And, as you know, the Better Medicare Alliance is a nonpartisan organization, and we hold a range of views on all sorts of legislation. And we always, are solely focused on, protecting seniors on Medicare Advantage. And we're just really curious, if you can share what you see as the current status of the reconciliation bill, and what you can share with our allies and our advocates on what they may be wondering how the reconciliation bill could be impacting their Medicare Advantage coverage.
Well, I think that there is a commitment among the Democrats to get a budget reconciliation bill on the desk of President Biden that will address the Build Back Better initiative and agenda, frankly. And in that, healthcare is critically important. Everything from paid family leave to the fact that states like Alabama didn't expand Medicaid. There are efforts in the bill to make permanent some of the subsidies and the premiums. And so I think at this point, what's going on is people are sort of jockeying for what stays in. And I'm of the school that instead of doing a across the board haircut on all the things that are in the budget reconciliation, we should pluck out 4 or 5 things and do really well. And I would hope that that would be to close the Medicaid gap. I hope that that would be to deal with our seniors and Medicare by expanding their ability to get vision and dental. For me, access to health insurance, period, i.e., trying to shore up the Affordable Care Act so that it works for all people is critically important. And so many of my seniors get their vision and dental through their MA plans, frankly. And so, I think that both are really important. And I think that figuring out in this big reconciliation bill what we can do really well and rolling that out, I think would be a better strategy. But I'm not in the room. I'm one of these centrists who will be voting for the bill. And so I haven't been invited to the White House. I don't have a crystal ball, but I can tell you that all of us are committed to getting a budget reconciliation bill on the desk of President Biden and doing that as soon as possible.
Thank you. And Congresswoman, I'm going to squeeze one more question in, and I want to respect your time. And the next question relates to work that you're doing and communicating with Cmmi, the Center for Medicare Medicaid Innovation, and an agency that we're all doing work with. And many of our attendees here today were able to hear from one of their top leaders, Dr. Purva Rawal. And you recently sent a letter to Cmmi calling for more transparency from the agency and encouraging them to seek out more stakeholder engagement. And we greatly appreciate your leadership there. And the Better Medicare Alliance was also a part of a letter that was led by one of our allies, the Healthcare Leadership Council. And so again, thank you. And if you can just, share why it was important for you to communicate this message to Cmmi and, what you're hoping to be able to see, from that agency in the months ahead.
Cmmi or Innovation Center was really created under the Affordable Care Act and is tasked with, testing and designing and implementing new healthcare delivery systems and payment models that would lower costs and improve outcomes in the Medicare, Medicaid, and CHIP programs. The current Cmmi framework does allow the executive to waive certain Medicare and Medicaid rules to test controversial approaches to the delivery of healthcare without negatively impacting the healthcare delivery systems. And I just think that we have to ask for more transparency in how they go about providing those waivers and about really testing these new approaches or frameworks. And so as the Innovation Center is a critical tool in improving, I believe, the quality and efficiency of our healthcare system, especially in rural and underserved communities. But I also think that it's really important, as we said in our letter, to recognize the important role that Cmmi has in testing different innovative delivery systems and to acknowledge its statutory requirements, as well as to, requesting that they have more transparency in their process and greater reliance on the use of present data to immediately understand the impact of the models on healthcare providers and patients. I think is something that's really important. And of course, as you know, the request mirrors, as you said, a letter that Better Medicare Alliance was so gracious to also co-sponsor. I think that it mirrors the Cmmi guardrail bill, as well as the Strengthening Innovation in Medicare and Medicaid Act that I introduced last Congress with Representative Adrian Smith and Tony Cardenas. And so I think that, there's a real opportunity here to test different models, but I think that we have to be transparent. We have to make sure that they are transparent in what they're doing and actually get input from providers, healthcare providers, and and place some guardrails on exactly how they're going about this. It's a great opportunity for us to provide different model systems and payment systems, as well as to really improve healthcare outcomes. And so it's a tool that we should use. And I think that that tool can be a blunt tool, but it has to include transparency as one of its hallmarks. So look, I think that Medicare Advantage has so many pluses to it. I think it's also important that we think about telehealth, and I have seen how great telehealth has worked in my district. It will never replace in-person communications with your doctor, but when you think about this global pandemic and how it's helped exacerbate some of the already existing disparities, especially in healthcare, I think that we have to use all the tools in the toolkit. And so to the extent that Medicare Advantage offers plans that provide that kind of flexibility, I think the more the merrier.
Well, Congresswoman, thank you. And had we had more time, we would have been able to also talk about how you have been a leader and champion in the telehealth audio space. So next time we have the opportunity to engage with you, our question and issues, we'll start there.
Absolutely. I think good luck on your summit. And thanks so much for the opportunity to speak with you all. And we're keeping our fingers crossed. Hope springs eternal when it comes to the budget reconciliation, sooner rather than later.
Thank you so much. We're so grateful for your leadership. Thank you very much.